All right, call recording is on. Here we go. We're starting up part 3. Kris, Eric, I know you're already here with us. Thank you for joining part 3 of the 4-part webinar series. This is going to be just really a stack on top of some excellent material that's been covered. And what I like to do to start any webinar is just say thank you to really a few people that have made this happen. For starters, Jesus, that I've got a smile and breath today. So here I am, but also a thanks to Affueled clients. It's really you guys that make any of this. You're essentially sponsoring this webinar. So thank you. You guys keep plugging in, giving us feedback on what's a good product and how we can help the auto repair industry. I want to say thanks to Rob last week. He really set the table on an excellent point with Solid Start about keeping our shops really not just providing a disinfectant or a cleaner or a sanitizer, but bringing to the table a potential legal, really a liability that could happen. So Rob, thanks for bringing that up. I promised that we would have that answered today. We will. I'll touch on that in a second. And then to go through, I just want to say thanks to everyone listening on the call, or whether you're on the call or actually in the join meeting sharing, or you'll be watching the recording later. Thanks for taking the time. There will be an opportunity to post comments. We'll put this on YouTube, Facebook, and our LinkedIn group, and we'll be looking for feedback on a couple questions today. I'm going to, before we get too far going into part 3, which is really, I'm going to kind of switch gears a little bit. If you can see the screen, this is going to be moving away from a no contact. Oh, now we're going to twist the word a little, call it social distancing. Really, again, this is just it seems to be what might be a cultural trend. And I'd say maybe it was a fad, but I'm already hearing of waves. If you heard Eric and Kris just talking, we were talking about there could be a rise in COVID cases as things are opening back up. So we just want to keep all that in mind. And there are a lot of webinars on this for a lot of industries right now. I understand that. But what we want to do is keep this very specific to the auto repair industry. Take some perspective from Eric from the medical. He's going to be our first guest speaker joining us again. And then I've got really a special speaker from us today. He has experience beyond, and I'm going to touch on that to kind of introduce Kris. I mean, here I am, right? People know me, the original mobile app ninja. I'm going to be our host, continue today and part 4 in a couple weeks. And I love to show this because this is going to set up Kris really well. One of our guest speakers. This is me in white. But if I move to the next screen, this guy right here, this time that's me in black when it comes to OEM data, how the dealers use it, what the OEMs are doing with it, and how it can really impact the industry, whether it's through technology or consumer interactions. So kind of picture Kris, if you will, as perhaps the guy in white there, and we'll get to that as we kind of move through. I just wanted you guys to see that. Kris, thanks for joining us. It's Kris DeWolf, formerly with All Data, currently with Auto Care Tech. So got some great things going on, Kris. Thanks for joining us.
Certainly, I'm glad to be here.
And Eric, again, with Vire Medical, I'll be just kind of showing you a slide of Eric. Eric, we appreciate your time again. I know you've been on the road, right?
Yeah, this week was really one of the first weeks I was out of my house from quarantine and out on the road visiting hospitals and kind of so I traveled from Washington to Montana to visit a hospital this week.
Okay, so I love getting that just on the ground feedback. So Eric, we'll ask you a few questions. Of course, I mentioned Kris. Here he is. You might recognize him from just his experience in our industry for going on almost 3 decades, right, Kris?
Yeah, I've been around a little bit. Was kind of been a keynote speaker at a lot of the conventions, the SEMAs, the NADAs, the NIADAs, and spent a lot of time in the space.
Okay, and Kris, you and I have bounced off so many ideas off each other. I mean, the things that I've been able to really like to actually back up where Kris and I first met. It was we were attempting to see if a repair shop on a small scale, right? Not thousands of repair shops, but one local auto repair shop could they get access to the OEM maintenance schedule on their own, and could they get the recall information on their own, and could they have access that just as quickly as the dealer technology could? And that's where I met Kris, and in fact he facilitated that happening. So anything we do now is based on kind of those foundational talks with Kris many years ago, probably going back, 8 years, Kris?
Does it go back that far? It probably does now.
Yeah, it was even before we got actually technically shops in iTunes, right? It was even when this was just a web-based online garage. So
you're right, because we were still trying to figure out how to break that iTunes barrier of see multiple apps with different brands, right?
Yeah, and we're still working on that one. That's Kris. So yeah, that might be another webinar series on the fun and joy of working with Apple. That'll be exciting series for those that love apps. But let's move on to, I'm going to kind of close it up. We're going to kind of wrap this up in about 40 minutes, and so that we're not, I know everyone's time is critical, but I will give us some very, I guess you could say, we're going to lead to a key phrase here. It's in there. I don't want to give it away, but it's going to be industry examples of what we're doing. So Eric, if you can, here's Eric's company. They've been featured on Fox News, and Eric is, he's out there. The ventilators are actually a public conversation. Eric, has that ever happened before when ventilators in the intensive care has become a public conversation in your experience?
No, I've been in medical equipment and sales and marketing for over 20 years, and for the most part, nobody even has ever heard of the company I'm working for. So unless you're actually an ICU nurse or doc or respiratory therapist, nobody's ever even heard of the companies until now. And then now it's kind of thrust right into the limelight of this whole coronavirus and prevention and what hospitals were needing, to really take care of these patients. So it's completely changed from being the unknown to now everybody was kind of talking about them.
Yeah. Well, and Eric, you just mentioned you got back on the road, so I teed up a question for you. I thought, what trends are you already seeing in that interaction that happened? Can you walk us through your encounter with a hospital?
Yeah, absolutely. So, my interaction with the hospital as a vendor coming in over the years has been changing every single year, even prior to COVID-19. But now at this point, we have to provide all of our shot records, any vaccinations, chickenpox, MMR, full documentation, background checks. And then within the last year, there's full security checks now that we have to sign in on an app that keeps all of that data. It tells how long we're in the hospital. It has to have a pre-approved appointment, who is like our sponsor within the hospital. And all this has to be pre-approved before you can even walk into the door. And then now you arrive and it's, they check your temperature. They ask where you've been. And me having traveled from out of state is definitely a problem. It took 10 minutes of them looking at their policies and procedures to see if they were even going to allow me, even though I had all of that criteria, met, to see if I was even allowed to continue with my appointment on Monday. And so each one of these things that has changed over the years has never been unwound. So even when there was a moment in time where H1N1 or SARS popped up and everybody kind of tightened their restrictions, after that let up, the hospital never unwound any of those procedures that they placed on us. They just kept adding them on top of. So I think in the hospitals, they're planning on this is going to be a long-term thing. This isn't a temporary change, that hospitals are going to be way more aware of infection, spread of communicable diseases, viruses, the cleaning and the procedures, and trying to keep things as low touch, even in their waiting rooms and coming into the hospital, is not something that's going away. This is going to be the trend going forward as they not just navigate this virus, but whatever could come next. They realize how vulnerable we are as a society, and just that's something that's going to be an ongoing thing.
Yeah, and Eric, do you remember when we had Rob with Solid Start Part 2, on what you just said, shops are new to this, right? They're new to explaining when something is clean or when something is disinfected or when something is sanitized. Now, that's been happening, but we kind of uncovered that with Rob, and he made it clear that there's potential liability. We covered that, and what really we found was kind of I followed up on that. It was that we're seeing cross-marketing that could put the shop in a liable state, where if I say that I have a sanitizer, but the label of the product that I have says cleaner, even in your advertising, you put yourself at risk that someone could essentially say to you, wait a minute, they said they had a disinfectant or a sanitizer, but come to find out, I researched what product they used. It was a cleaner, right? That's all that the label authorized them to say. And so wanted to just kind of, that I promised I'd follow up with that. And I that's my encouragement to all AppFuel clients is in your marketing, the word that you select, make sure it's representative of the label of the products you are using. And just wanted to bring that up, Eric. Now, hospitals, that's probably probably a no-brainer. That small little concern, but perhaps I just felt like it was a good reminder for our industry to take that seriously.
Oh, for sure, and not just the cleaning, but then it's also they want to make you feel comfortable and know that they've got the situation handled. I think that's a big part of it as well. And I even saw that in restaurants, coffee shops, as I was kind of traveling around. All of the workers, when they're wearing masks, when they're making your food, or taking your credit card if they have to, just makes you feel more comfortable as a consumer, and they're taking those extra steps so we feel comfortable to go about our day as normal as possible. And I think that's a huge thing, to keep that as touchless and as good as they possibly can do. So.
Right. And Eric, if I can ask you, we're going to get specific auto repair here for a moment, but I wrote down three things. I wrote down artificial intelligence, automation, and remote work as essentially a trend. But out of that trend, what do you see happening in the medical field that we could apply to the auto repair industry?
Well, I think the trend to going to remote communication and as touchless as possible is absolutely a trend. I mean, everything we've got, digital apps that actually show the equipment I'm selling. The ventilator can display it. We actually were talking about this on the pre-call. Can actually display the ventilator in 3D rendering in the middle of the room so that it can be looked at and seen without me physically bringing in a product that's touched and hauled around and could have some different, spreading bacteria points. So, because they don't want me hauling a piece of equipment that goes from hospital to hospital to hospital. So this is a way to kind of stem that tide as well. And then everything I do, checking into the hospital is now on my own phone, my own device. No longer do I go to a PC that multiple people log in, during the day. It's just I log in through my own remote, show them my badge on my phone, and there's less physical contact that's actually happening. So that's a real thing. So the handshake is gone.
Yeah.
The handshake is gone. We stand a few feet apart, just greet each other with a nod, and it's just.
Yeah. And Eric, we talked about this.
Things moving now.
Eric, we talked about this a couple of weeks ago. We were kind of roundtabling the idea that perhaps the kiosk idea had its day. Don't know, but not in terms of it being an object that could be touched by multiple people. And instead, the new kiosk will be each patient's or each customer's smartphone. That'll be the new kiosk.
Absolutely. Yeah, that's a definite, because no longer do they want the kiosk in the lobby that 1,000 patients come and touch, as a single touch point during the day. So they're having to eliminate whatever they can think of as a single draw that is going to have so much contact and possible chance of spreading is being eliminated. So yeah, they want you checking on your own phone. They don't want some kiosk that they have to clean every single time that someone touches it, because you'll wipe out screens with disinfectant. You'll ruin keyboards, because the chemicals they're having to use in the hospital are so hard on technology. If they have to wipe down a computer keyboard, after every single person that touches it, it's going to destroy it within months.
Yeah, and so Eric, great lead in, because Eric and I, we've known each other over 20 years, Eric, and so we get some random texts going to each other, and I love that you sent me this one. Was this yesterday? This image here? Yeah.
That was outside Post Falls, Idaho.
So
still, a little remote community. It's not a big town, and this is their 76 gas station, highlighting QR code, safety, and also trying to do the same thing the hospitals, which is eliminating that touch point where you could have hundreds of people every day who may or may not have washed their hands or used Lysol wipes or anything.
Yeah.
Could be possibly spreading that touch.
Yeah, and I love it when you sent this because I had already wondered why I had to enter the zip code and on the little touchpad at a gas station. I've already been wondering that, going, wait, I'm touching 5 different buttons here, right? Then I'm clicking the little screen, and I don't see anyone walking out and wiping all that down before the next person pulls up for gas.
Never. Nobody's wiping down gas pumps at all. So the handles are one thing, but if you can eliminate the keyboard, because the keyboard, if they even did wipe it down, it would wreck it. The screen, those aren't built to withstand the kind of chemicals that we have to wipe down things.
Yeah.
With the frequency to be able to handle it. So.
Now, I mean, in a note of, depending on if you join this webinar because you're into conspiracy theories or you want real practical advice, I could see this being a conspiracy, right, Kris and Eric, where we've got this, wait a minute, we're just trying to move to a cashless society. That's what this whole thing is about. So if you're interested in a conspiracy theory webinar, I'm going to drop it there, unless, Kris, you want to jump in. But
I don't think you want to get me rolling on that subject.
Oh, okay. All right. That's not what this one is. Stay tuned. No, just kidding. We're moving along. So, Eric, thanks for sending that over. I thought that's going to be the way where I could see, okay, we're all going to be not asked to touch and enter zip codes and sign signature pads. This might all just be going away. It might be we're just paying on our phone, clicking a link, text to pay, who knows? But the central point that we're all touching, it could be just maybe not a prediction, but we're already seeing it being moved away. So, Kris,
exactly.
We can transition here. Eric, thanks for sharing that and just what's happening right now.
My pleasure.
In hospitals and how we can translate that to what we can at least predict could happen at an auto repair shop next. So, Kris, if you can, I've introduced you already, but really you are, as far as I know, the number one automotive technology expert from an OEM and a dealer perspective when you think of how it's used in technology. Can you just give us a little background of yourself and perhaps what you did at AllData?
Sure. I worked for AllData and AutoZone for 20 plus years as a product manager and a business development manager. I was very fortunate during my time there as technology was really being adapted and AllData was kind of out on the front end of it. And I was able to kind of ride that growth in technology in the early 90s through the mid 2000s and on through to today. I held positions as marketing manager. If you got those AllData postcards back in the early days or back in the early 90s, that was me. I apologize for flooding your inbox there. But really what I did was I built custom products for them and built product solutions for the industry, starting with the industry's first CRM system, electronic customer relationship management, building hosted websites. Pro Car Care Zone was the product, built point-of-sale systems, data products, and ultimately designed systems for AutoZone and programs for AutoZone where today Firestone, Amco, Jiffy Lube, Meineke, and just about any brand you can name out there is running either a point-of-sale, a marketing, digital inspection, or a repair information system I designed for.
Wow, Kris, thanks for that. And if you can, maybe how do you see if there was a legacy, Kris, of what you did with AllData during that window? What's the legacy of the impact you left on the industry?
Well, there's a lot of things. My goal at AllData was always to focus on automation and standardization of common tasks, right? There's only so many cars and so many parts out there, and as an industry, we spend a ton of wasted time writing service and diagnosing the same things over and over and over and over. I did a study at one point that if an alternator failed on like a 2002 Acura, there were 14 different estimates written for it before it was repaired, and every one of those estimates was different, right? And that's one of the most common fixes we have out there. So I focused a lot on automation and trying to design systems and really automate the process from inspection to parts ordering and on through customer contact and care and retention. But the CRM system really sticks out. We were kind of before our time, and there were a lot of inherent problems back then with digital communication and a hosted website and email communication with your customers, in that both the industry and the customer base wasn't ready for it. You had early adopters from a customer standpoint that just flocked to it. But there wasn't that many of them. It took me, I think, 6 years to hit 1 million online appointments with that system. But at the end of the day, there were a couple compelling issues. One, we didn't have mobile platforms. There wasn't tablets and phones. So you had to sit down at a computer and want to go to a shop website. And really, there's no compelling reason to want to go visit a shop website unless my car is broken. So we had frequency issues, and that impacted the ratings of websites. I mean, this is in the early days of Google keywords before they were out and things like that. But we had just adoption issues. All the technology was there. Everything was needed to enable kind of a full digital and automated communication platform. The world wasn't ready for it yet. There were very few people. And as time progressed, that became easier. More people adopted. And pre-COVID, kind of what we saw was the younger generations, the adoption of cell phones, the preference for digital communication kind of had like a 40-year-old cutoff, right? And now I think what we're going to see as a result is that comfort level, that usage, that adoption is really zooming up across all age levels, out of a demand, out of a need, and out of a recognition that that digital communication is honestly easier, more convenient, and at the end of the day, it's a safety mechanism now, and I think that's forcing the adoption that wasn't always there. Right?
And Kris, that's why I'm thankful. Really, it takes someone or something or some entity or really maybe even just a vision to understand what's going to happen next. And I felt like you prepared all data for that in terms of, wait, we can build databases that collect data on both what the OEM is providing, but also what the repair side of the industry is providing. We can combine that data together to bring about an efficiency. And I feel like, Kris, you probably predicted that well. Right now we have years of data of how this is done, the time it takes, and parts relationships, and many things going on because it seemed like it was predicted, maybe by accident. It sounds like maybe you just had it called already, Kris, 20 years ago. But this data could technically be used to improve what the consumer has access to, the convenience level they can get. All of that happening today, post-COVID or during COVID, it seems, was kind of set up by this foundation of connecting data together. And
yeah, it's a good point. The data element, I'm a huge proponent of leveraging the data you generate in your business to your benefit. And unfortunately, automotive market as a whole just doesn't do it very well. You kind of break it into segments. You got a dealership segment, OEM new car, you got used car, you've got collision, and then you've got kind of aftermarket repair. Collision is the best at data. It's all automated. You don't handwrite a job. You pull a known job off a list, and everyone that writes it up writes it exactly the same. And that was caused by insurance companies and needs for standardization with the data and liability across multiple large organizations. The manufacturer has to deal with it. The collision repairer has to deal with it. The vehicle owner has to deal with it. The insurance company has to deal with it. So there had to be a standardization of data across that segment of the industry. They have the best data, they analyze it, but they don't share it with anyone. They keep it very private amongst the collision repairers and the insurance companies. And a little bit ekes out to the OEMs, right? The vehicle manufacturers. The dealerships, on the other hand, they're standardized a little bit differently, right? They don't have the level of standardization with data and with service writing that the collision shops do. There's variation from dealer to dealer and from brand to brand. But they do rely heavily on standardized data internally from the individual dealer up to the OEM and out to their service providers. So they have large systems, robust point-of-sale systems and shop management systems. They invest heavily in technology that automates all that data, and that enables a level of communication and analytics that really doesn't trickle down. And again, they don't share data with the other segments of the industry, right? Yeah. When you get to the aftermarket, when you get to used car, it's kind of the wild, wild west as far as data goes. You have segmented point of sale, right? There's 170 point of sale systems out there in the market that have 200 or more customers. That's an insane level of fragmentation for data in the aftermarket. So it's very hard to consolidate, to analyze, what happens across the depth of our market at that level. And again, it's not shared. None of that data is shared amongst the parts providers. Everyone has a little visibility into what's going on, and no one really has that top-down look. And that's really what prevents the automation through and through.
Yeah. Now, Kris, on that point, this isn't going to be a doom and gloom segment here, but perhaps it is, right? Let's say that the dealer or the OEM working together basically have a leg up at the data first, right?
Yep.
They have. It always seems like they have the edge. I suppose if, let's just say we grant that to them, that they have it, what are they adopting that an auto repair shop could also adopt, though, right? Where there doesn't, like, basically, let's say the edge is there. How can we minimize it between what the dealer's doing and what the auto repair shop is left with?
Well, the good news about the dealership market is they've always kind of lagged on putting the tools together because of bureaucracy and the size of the organization. Okay. Historically there was a good relationship between a dealer principal and the OEM he worked for. That all went away when the market crashed several years ago. And the dealers realized that the OEMs aren't their friends and their partners, that they have to kind of invest in their own business independently. And the most notable change that occurred at that point was the revenue share generated from their service lanes. Dealers now generate about 46% of their total revenue out of that service lane. Okay. The money they make is out of that service lane and out of their used car bay. They don't make money from selling new cars anymore. So that created kind of a different dynamic between the OEM and the dealer. And so things have started to change. Today, over the past few years, heavily investing in digital marketing communication tools. You've seen remote car buying. They've recognized they've got to minimize the touch points between the consumer and the dealership, and that was always a cumbersome experience and probably impacted their levels of service. The OEMs are supporting those efforts. They're providing factory apps, tools, leveraging the data to communicate directly to vehicle owners for extended periods of time beyond warranty, trying to bring them back into the dealer. And the dealer's duplicating that effort independently and doubling down on the effort. They're taking the same data their OEM partners are taking, and they're farming it out to independent partners to enhance their marketing and their communication and their tool sets to work with the vehicle owners. The goal of all these guys now is to extend the relationship from 3 years, which is the average warranty cycle of a vehicle owner going back to a dealership for service, to 4 to 7 years. And they're having some success in that space. Over the last 5 years, that dealership service group has grown steadily. They're the ones taking business away from you today, and they're going to continue to do it because the OEMs are going to continue to design proprietary systems that drive cars back to those dealers for extended periods of time.
Yep, and Kris, we're going to get right back to that, but don't let that go, because we're going to talk about the three things that dealers are basically. It seems like it's battles that they're going to win. They're doubling down on their efforts to win these three battles, and I'm about to get that, but I did want to skip over. You have talked about this company. I know you've been involved with them intimately at just kind of different levels to your career. I did want to skip over Identifix and see if we talked about all data. I mean, not as if we're selling all data in this webinar, but just the value they brought to the industry. What about a company like Identifix, Kris? What value are they bringing, and what angle are they presenting to the industry that we could, as the audience here, kind of gain from that experience you've had?
Identifix, very similar company to AllData, very similar to Mitchell as well. Those are kind of the three standard data products out there in the market. Identifix came up a little different from AllData and Mitchell. And just touch point, I worked for Solera, the parent company of Identifix, for the last 3 years. Just left them in February, so that drives my familiarity with them. Identifix came up a little differently. They collected user data, and they represented it to the market in the form of a likelihood of a fail tied to a symptom. So technicians call Identifix and say, I've got a problem, I can't figure it out. Here's the diagnostic process I've gone through. Here's the results. what do you think it is? And Identifix says, well, it's one of these 5 things, and based on our experience, 70% of the time it's part A, 20% of the time it's part B. So that shortens your diagnostic cycles and focuses your tech a little more accurately on where to find the problem. So it's kind of the de facto first lookup when a car comes in from a diagnostic standpoint.
Okay.
Very good at collecting data, very good at presenting it. All of the tools are similar. You should always have an OEM data source that prevents liability in terms of your repairs. It presents a level of knowledge and expertise to your customers that you really can't create just through personal interaction. Because if you hand your customer OEM data, if you present them OEM data, if you're presenting them the information from the Ford manual, says this is how to figure out what's wrong and how to fix it, there's not going to be that natural argument to the services you're offering. And it standardizes your communication with the customer. It gives you a level of professionalism that typically isn't there.
Yeah. Now, I'm hoping my audience wants to know this, Kris, but I've always wanted to know this. Do you see this information in what you just said, where maybe a code comes up or there's a symptom, and then Identifix can basically tell you what the percentages of what the solution might be? Do you ever see that arriving at the consumer? Could the consumer, the vehicle owner, in some way, is there a pathway for that to happen?
Yeah, very, very much so, and it's out there today. Like any of the technologies we've kind of discussed, and even like in the medical field, these things were kind of laying around. They were in use in segments. They were in use as pieces. Fleet management has always taken advantage of this heavily, right? And now we're starting to talk about telematics and remote diagnostics and remote monitoring of a vehicle and tying that back to the shop for additional services and communication. Kind of that omnipresent repair entity that's always with you, right? If my car throws a code, a tow truck shows up. I didn't even talk to anyone. That type of environment. Yeah. And so all those pieces are there, and they can be taken advantage of today. And they're starting to come to market as packages that can be deployed in the aftermarket. But that's what the dealerships are doing. That's what the OEMs are doing. They're trying to do it from a proprietary standpoint, and they're having some success.
Yeah, and when you mean proprietary, you mean locking out the independent shop from having the same access?
Yeah, we're kind of de-evolving to the early 90s and security systems when the OEMs and diagnostic systems, when you used to have to take your car to a dealer to get the lock codes reprogrammed or the engine codes reprogrammed. When you take the battery out, replace the battery, then you'd have to take it to the dealer to have them reprogram the car because they weren't giving out those systems. It was a specialized tool that did that only the dealer had. Went to court, Freedom of Repair Act, all that good stuff. Those days went away. Now we're moving back to that with proprietary vehicle systems. That OBD2 method technology is kind of meeting its limits, and the amount of data coming out of a car can't really be translated through those standardized systems and really kind of falls outside the purview of the laws and codes that were written around it. So, the extreme example of that is a Tesla. Tesla is not considered a car. They don't follow any of the rules that are applied to cars in terms of data, sharing data, making repair information public. It's a closed system. And if they win that fight that it's not a car as we know it, that it's a new piece of technology, they can effectively close off the aftermarket from ever touching those vehicles. And that's what the OEMs are trying to do. That's what they'll always do, is try and give their dealerships a leg up. And they'll win some fights and lose some fights.
Yeah. So I guess a big shout out for lobbyists of the auto repair industry. Keep doing great work, right?
You don't hear a lot about them, but they're out there and they're fighting for you. Trust me.
Yeah. And Kris, I put that on there. I put it in bold. We were headed this way in the conversation. I said we'd get back to it. And you even brought up kind of the precursor to that was the OBD2 diagnostic code and really some of those products that even the consumer might have seen coming in from their insurance program, right? If you had, I think it was Geico, there was maybe Allstate rolled out these OBD2 devices to consumers. I feel like it's close. Consumers aren't grabbing a hold of it at high percentages. It leads us to what we were just talking about, a connected car. And what I put here, Kris, you tell me if I'm wrong, but these were the three things I could think of based on you and I and what we talked about. Here, it seems, are the three things they are fighting to win. One they want to predict the repair need before it happens, right? If the dealer can do that, and they've got the consumer essentially in their hands, if you will, if they can predict that repair need, the person won't even go to Google to find their next repair shop. It's not even going to happen, because
no, you're exactly right.
The timing is going to be perfect. The dealer is going to know when this is going to happen, what's going to happen, give them an easy way to get in and out, whether it's, valet pickup and delivery. The whole thing will seem seamless. And that leads to point two. They want to win that in terms of meeting the changing consumer expectations. A consumer doesn't want a random app on their phone that collects OBD2 data and they get random diagnostic codes. That's not keeping up with consumer expectations. So what I'm seeing is you have the OEM and perhaps the dealer on maybe first time in history coming together in terms of, and I'm about to show this with the My Buick app, where you talk about really trying to not just connect the car to the consumer. I've always felt like that's a great endeavor, but it seems backwards. If I was at the OEM and I was fighting against the repair shops, I would be trying to figure out, how do I get the consumer to connect their car to us?
Yeah.
And that seems to be what the mobile app allows to happen. Now you have a consumer who 3.8 hours a day is on an app. They step in their car, whether it's on screen or on their phone screen, and actually being enticed in some way. And we talk about that, we talked about in part two. There is a customer engagement rule that can't be broken. We can't be just giving things away without engagement in return. And I think the OEMs are starting to figure this out. They're going, wait a minute, we can talk about connected all day, and they take polls all day. And that's not the number one thing that people are looking for in their new car. They're not looking for advanced technology. That's not current. It's coming up in the charts, but it's still not what people are making the decision on the car that they buy. And so if the OEM can start to make that where the consumer is choosing to connect because of these values, A, B, C, now that's the battle that they want to win. And that's my concern for our audience, Kris, for the auto repair shop, is if this battle gets won, the customer will never even do the search.
Oh, that's very true. They're trying to cordon off the direction of the repair search, and they're enabled to do it at the end of the day. I mean, 6 years ago, the OEM and the new car dealer did not care at all about the aftermarket or what happened to their vehicles in the aftermarket, to the point that they had no visibility to the data or repairs after that 3-year warranty window. Zero. Right. I worked with every single OEM out there. There was not a single one that was pulling in aftermarket repair data or part failure data outside of their dealerships and their own brand. They just ignored it. What changed that was the recall crisis. And they realized that they had to start looking for sources of data to find out what was happening to their cars out in the market after that 3-year window. What was happening to that car in year 6? What was happening to it in year 7? Right. That forced them to go out in the market and buy additional repair data from the aftermarket. They started getting invoice data. They started going to Carfax going, hey, what do you got? Give it to us. And that enabled them to start doing this predictive analytic repair data on their cars and on multiple vehicles. Now a Ford dealer, based on your location, your miles driven, some sensor readings outside of the vehicle that actually come through the app, they can identify when your car needs an oil change, not by its mileage or anything else, but by the condition of the oil. They can tell when your battery's not hitting on all cylinders. There's a lot of data. I mean, it gets down to, at this point, you can predict rain, and it's not really prediction, but I could tell you more accurately where and when it rains by analyzing windshield wiper data from connected vehicles than I can by any radar or satellite system on Earth.
Okay. Can we put a revenue stream to that, Kris? That sounds exciting.
They're out there, but the amount of data coming out of cars is insane, and it's not just the amount of, and it's this race to this fully automated vehicle that is what we're talking about. The OEMs are investing in the future. Everyone's got eyes on this new world where the car drives itself. Basically, you're driving your phone around, right? All your apps are connected, your home network's connected, your work's connected, and the car is doing everything it needs, and you're just sitting in it, basically in your living room. That's the race. The reality of it is we're still 20, 30 years away, and the technology that's being deployed and it has use in the market today. How do you get it to existing cars? How do you get it out into the market quicker than the adoption of these automated vehicles?
Yeah, and Kris, for me, because I come from the dealer world going back to 2004, to me it has always started at the F&I department.
Yep.
Right. If I'm the consumer and there I'm in finances and I'm figuring out how to buy the car, and my Buick is figuring this out, by the way. I had a guy who just bought a Buick a couple weeks ago. He fired this over to me. He goes, "What an amazing experience at my Buick dealership." So here you have the dealership and the OEM working together. This is not an app that was put out by the dealership. This came straight from, GMC. And this is an app that was being sold, if you will, right at the F&I to the consumer. And he loved it right away. He's got access to remote control, take control, check in, discover on the go. I think the reason he reached out to me is Jeremy, this is going to shut you guys down. That was actually why he brought this to my attention. He said, this type of seamless, amazing consumer experience through an app, and I'm not even looking for jobs, is going to shut you down. And I'm going to debate that in a moment. But on the other hand, though, if the dealerships are winning this battle, where now the consumer is excited to get the data, right? The consumer is excited to be connected, and it's not the other way around. This is going to change things. And I wanted to present that in terms of if the consumer is excited, they're going to do things they might not have done before. In this case, I have a couple Buick vehicles in there, but you could add all of your vehicles in there. The way it is, and really through efforts of yours, Kris, and all that over the years, GMC is not locked into just their data. They can outsource any manufacturer, and you could essentially have your other vehicles in your My Buick app. Because really they know if they're continuing to do service within 5 years, they're 6 times more likely to resell you on that same car brand. So
don't blame me for enabling that.
you saw me work that in, didn't you?
It's not my fault. Go on, let's be clear.
But someone had to be predictive, though, because again, I think it still helps us. I don't think I don't think it's over. I don't think it's lost, because if I go here, look what Firestone did. This isn't an OEM, right? This is a repair center who knew what they were doing, and they were understanding locking in a customer. So they're bringing the same tools to all of their franchisees, or in this case, just retail locations. That one app powers their every consumer engagement. And if I was at their top levels in their marketing, I'm assuming that's what they're trying to do. What is every touch point we can do in the lobby, by an email, through a push notification, through a text message, through a phone call, drive them to this experience, the My Firestone experience. So I don't think it's being lost on the people that have the funds and the Fortune 500 budget to pull this off. We've got to keep up. We can't just give up. You know where I'm going, Kris? I think it's going to be hard, but I don't think we can just give up and say, well, they're already ahead of us. Everyone's already got an app. We're just giving up on it. We're going to stick with email and hope for the best.
Oh no, the fight's definitely not won, and there's a long ramp up period until they achieve a level of closed loop security around their vehicles, and then a little bit more time that'll get chipped away by legislation, like we've discussed previously. But okay. You're correct. There's more than enough opportunity, and look at what the small businesses are doing today, right? They're leveraging these tools where they haven't before. I live out in the middle of nowhere in California. I'm 45 miles from the nearest big city. I've got a little pizza shop and a gas station over here, and it's a nightmare to get a pizza from this place. And 2 weeks ago, I went to their website to get their phone number, and lo and behold, they had enabled internet ordering, right? Wow. It just popped up on their website. Yeah. It's so easy for me to order from them now and get a pizza from them now. I don't even like their pizza, but I'm doing it because it's convenient, right? Same thing with automotive repairs. Same thing with any other service industry. People are now open to digital communication that weren't in the past. Typically, it's an age barrier that kind of defines that. The younger generation prefers not to talk to a human. They don't want to pick up a phone. If they can go to a website, get the information they want, make an educated decision and feel comfortable with it, they're going. If they can do that through an app, through a known relationship, they're even more comfortable, right?
Yeah.
So having that one-to-one communication and making it easy and being able to communicate in their preferred method, that's number one. Number two, now that's becoming a mandate. If you don't have it, now there's a group that isn't going to do business with you at all. You don't have an option to not have it. You have to have it. So it's becoming the standard for communication. So by all means, there's more than opportunity. It's almost necessary at this point.
Yeah. And Kris, I have to jump in with a plug for part 4. I'm not going to reveal it today, but we've been surveying vehicle owners across all generations. And Kris, I think you took this survey. You know the one I'm talking about. We had it sponsored by App Fueled. It was a survey that went out. I'm actually really excited, not because it shows that we're on the right track, but it gives the exact answer that I've actually been looking for. I've been wanting to see in kind of a collective sense, how far have we come as smartphone users in our preferences? Say we actually stacked up. If we just had them weighed against each other, say text messaging versus an app, or email versus a text message, actually just kind of put them up and pair them up against each other. So the results on that survey are coming in part 4. I've got a couple, and I've shown you a slide on convenience here. It's going to touch on that, and I want to just encourage people to say that there are a lot of good app developers out there who can take your idea and they can put you in iTunes. It's not a Fortune 500 choice anymore. I mean, yeah, 100,000, 200,000, invest in this. Let's get this done. I'll talk to you in 2 years. There are app builder platforms out there. That's why we exist today. Our sole purpose is to help the auto repair shop, what I'm calling the small guy, which my favorite guy, because that's us, is to say, let's give them the same tools that an OEM, that a Firestone, and that's what I'm showing here as an example. Laura Lee at Smith Auto Care, let me get this on here, but this is her app, and as you can see, it's her in the App Store. App Fueled is essentially an invisible element to her consumer. She looks like the real deal for her millennials, and as I'll reveal in the survey results, it's not as slanted as we might think on in terms of generations as who's using apps. So I'll be excited to share that in part 4, Kris. I hope you can join us for that one too. I've got one stats pull up. This is not from our survey, but it stands out on what you just said, Kris. Have you seen this one by Entrepreneur? They said 70% of consumers expect personalized experience from brands. Now, that one stood out to me because, of course, I'm looking for evidence to support what we're doing. So you could say I've got this inherent bias, but it stood out to me because I can't think of another experience in terms of, here we are, right? We're in COVID. Almost all of our experiences are digital at this point if we're working with any business at all. So I couldn't think of a different situation where I could allow basically the consumer to be allowed a personal experience unless it was an app. Right? If it's a text message, it's a text message. I didn't get to personalize when I wanted that text message, what I wanted that one for, if I even really wanted that text message. A text is great. Don't get me wrong. We've got that in there too. But to think about this sense of, and the other stat, I didn't pull it in here, but over 90% of communications today from small businesses, if it's just that kind of that general marketing reminders, are viewed as an annoyance. And that's what stood out to me, Kris. I was trying to connect that and say, wait a minute, we're being annoyed by marketing, although we're all claiming we want it. But on the other hand, we all are now expecting personalization. It seems like that's what the app allows to happen. What do you think, Kris?
No, I agree with that wholly. You're touching on kind of the commoditization of repair services. If I want a Coke, I don't really care where I get the Coke. But if I want one and I'm getting marketed, I have a live coupon or something hits me, or, you can get a discount on a Coke, I may make the choice to go to that particular location to get that Coke. There's been kind of a trend where we're starting to see oil change and brake services start to move into that commoditization zone. Doesn't matter where I go, I just need to get it done. Whoever hits me first, I'm going to go there. I'm not really asking who is the, historically it was word of mouth. You ask your friends, your neighbors, your brother, your sister, the guys you worked with, hey, who's a good shop? Hey, who can work on an Audi? Who can do this? Who has a good price, right? And you got a recommendation, and that's where you went. And if you had a good experience, you probably went back there all the time, unless you got a coupon for an oil change somewhere else that drove you over for a convenience purchase. We've driven more towards any port in a storm in automotive, and we need to move back to that trusted repair, because that's what those consumers are looking for, and that's what these apps are enabling, and that's what the Firestones and these guys are emulating. Firestone's trying to create an environment where, I may go to the Firestone down the street from my house all the time, but what they're trying to do is you get the same level of service, the same greeting, the same everything from the 130 miles, or when you break down in a different city. They want you to feel like you're going to your personal guy every time, and they're trying to enable that through these activities. Little different when you're a single shop. You have to leverage those same tools to create that trusted relationship and maintain it. And then when that customer's out of town, he's not going to that Firestone. He's actually contacting you through the app for a recommendation and advice and coming back to you. You may end up sending him somewhere else out of necessity, but you're his first stop. You're the one you trust. And that's what these tools enable you to do, is create that constant communication, that open flow and share of dialogue about the consumer's vehicle that honestly isn't a regular communication. It's at a point of emergency for the consumer. At that point, they're having a really bad day when they're talking to you through that app or communicating to you. And your response and how effective and how efficient it is going to make or break that relationship.
Yeah. So it seems like even the shop has to predict in terms of, well, let me train my customers, let me get it in front of them the way that we can help them predict their repair and help them avoid that bad situation, right? And so I just brought up a couple examples just to show, whether it's printed material, and this is really whatever it is you want to train your customers on, just use, I'm just going to show a couple, it's a printed item that talks about your text message program or your app program or your OEM maintenance schedule that you can share through email, whatever it is, promote it. I've got maybe it's a promo video. Nothing's taking off more than just watching videos with our free time. So get yourself a promo video of some kind that's talking about the way you want to communicate to your customers in terms of what's in it for them. So less about you, more about how you're meeting their consumer expectations, and make yourself look cool, right? I put together with our design team, we got this promo video done for Lower Lee. I'm going to just kind of have it going on the screen here while we talk. It runs the consumer through, and just so picture what it is about your shop, right, that you want. Get that uploaded on Facebook. Get that uploaded on YouTube. Get that conversation going that helps navigate the waters, where the reality is you're going to be seeing your customer less physically because of social distancing. So whatever tech you've got, and really, and we're going to be covering that in part 4. I've got a business coach from really, I think they're the top coaching groups in the country. He's going to come on. He's going to be our guest speaker in part 4, and he's going to talk about really how to train your staff, the technology stack that's available out there. How can you combine what's available to our industry to pull this off? And it's going to. I'm excited. His name is Mike Cost. He's a former shop owner. So kind of tee him up here for what he could share with us. But I'm excited mostly for his training. I feel like when you see, there's also going to be 2 freebies that are coming from his group. They've got a checklist for that technology stack, so you can make sure after the webinar to walk through that. And there's also going to be really a digital branding checklist to see if you're checking off all of the items and your staff is aware of them. So
excellent.
If you connect the dots, Kris, I'm pretty excited about part 4. Here's just another idea. This one was cracking me up because I thought, what a great use of our. Hey, Kris, tell us what was that you said about the X's every 6 feet?
I said one of the most under talked about impacted groups from COVID are pirates, because with the addition of all the X's on the ground every 5 feet, they have no idea where they buried their treasure.
I thought that was words for the pirates watching. We're sorry, Kris. Thanks for that. I'm gonna and Kris, I'd ask you this if this is okay, but I know you don't have hardly any free time at all. But are you comfortable with this? If one of our clients wants to reach out to you and just really just kind of grab your attention and ask you some questions about maybe tech consulting or software. Are you up for that?
Oh yeah, most definitely. I love talking to shop owners and managers. It's one of the things I enjoy more about this industry and this business is talking to the guys on the ground and spending time with them and helping them improve their business. I mean, that's what my career's been about. So when I get to do it one-on-one, it's a treat.
Okay, thank you, Kris, for that helpful tool and resource to our audience. And Eric, thank you. If you're still on, I appreciate that you came on and gave us the ground floor with the hospitals.
Yeah, absolutely.
And I'll end here. Like I said, don't think the battle has been lost. There are app builder platforms out there. We've made it easy to find out what it costs. So if you're even thinking app or you contemplating building a plan to get one, you could start here. We've put together a resource on how to walk through really what we talk about. I don't want to be hypocritical. You can go to this tool on your phone, and you can walk through really an interaction with our company. You get to meet me on there and get to select the items that make sense for your business and find out what it costs. So if you're looking for budgeting and maybe things are slow and you're trying to figure out what to do next, consider that tool. You just go to appfuel.com/quote. I want to say thanks to all of you for joining in. I'm giving you an Air 5. It's not working too well. And I want to say as well, do not miss part 4. I've definitely teed this up. I can't wait for Mike to join us. He's a business coach with, decade of experience and about 30 years of shop ownership as well. So thank you to everyone for joining. I'm going to be signing off. Thanks, Kris. Thank you, Eric.
Thank you, guys.